Hello, I'm Dr. Rob Hicks. I'm a GP practicing at the Randolph Surgery in London. Sciatica is a pain caused by pressure or irritation or compression of the sciatic nerve. Now, the sciatic nerve is the longest nerve in the body, and it starts at the back of the pelvis, runs through the buttocks, down the legs and ends in the feet. Sciatica is relatively common. Obviously it's not as common as simple muscular back pain, but it's nevertheless quite common. And the people who are more likely to develop sciatica and suffer as a consequence are those over the age of 40 and those people whose jobs mean that they are very, very physically active, so they risk damaging their back and triggering the symptoms of sciatica. The symptoms of sciatica are pain in the lower back that goes through the buttocks and down the legs and may be felt in the calves and in the feet. And that pain can be very mild, or it can be incredibly severe, so it can be really incapacitating. Now, some people also suffer numbness and muscle weakness in the legs and in the feet, and some people often get tingling in the feet as well. The two different types of sciatica: there's acute sciatica, and that's defined as sciatica pain that lasts less than 6 weeks. And there's chronic sciatica. That's the sciatica pain that goes on for longer than 6 weeks, and often that will go on for months, sometimes years. When it's acute sciatica, and that's the sciatica that lasts less than 6 weeks, generally speaking, an individual with sciatica is able to manage that, to look after, to treat that themselves. So they use over-the-counter painkillers and anti-inflammatories to relieve the symptoms. Exercise and keeping active is actually encouraged nowadays because that will help to speed up the recovery of the sciatica and lessen the risk of longer problems. So if somebody needs to get back to work, they should also be encouraged to return to work as soon as they can. When treating chronic sciatica, the doctor is more likely to recommend prescription painkillers. They may recommend physiotherapy, chiropractic therapy, and they may actually recommend a form of therapy called cognitive behavioural therapy. Because of the ongoing nature of this chronic sciatica pain, it brings people down. And by having this form of therapy, it helps people deal with the pain more efficiently and more effectively, but also have a more positive attitude to dealing with it. And that can actually make the pain less and help the pain to be kept under control. Now, sometimes it is necessary to offer people back surgery to overcome this problem, so it might mean surgically removing part of a disc if it's the disc that has slipped and is irritating the sciatic nerve. It might mean actually making the spinal canal wider, and that's called a laminectomy if damage to the vertebra or changes in the vertebra, the bones that make up the spinal column, are irritating the spinal canal. Or it may necessarily mean actually fusing two vertebrae together. In the case of where one vertebrae, you think about a column of blocks, has moved forwards on the other one such that it's now irritating the nerve, and what you want to do is fix those in place so that can't move. So surgery is an option for some people and is actually necessary for some people to treat the long-term chronic sciatica problem. I would say to somebody, if they're not sure of what the diagnosis is or what to do, then certainly ask their GP for advice. If their symptoms are not getting better despite the right treatment, or indeed are getting worse, then seek advice. But if their sciatica back pain is accompanied by other symptoms like a loss of bowel control, a loss of bladder control, then certainly don't wait. Seek urgent medical advice to try and avoid more severe long-term problems in the future.